Okay, so today I'm going to talk about the use of situational judgment tests for assessing non-cognitive attributes of final year dental students. I'm just going to adjust this right over here. Okay, so dentistry is a field that requires extensive theoretical and clinical competence, although technical knowledge is sufficient to get a degree, but not every dental graduate performs well when they are in a workplace setting. And literature has stated that although thousands of students graduate every year, only 20% of them are able to start their clinical practice independently or are ready to work in a clinical setting. And there are various factors that influence a job success that have been identified in the literature that include working environment, salary, rewards, incentives, work-family related factors, self-efficacy, and an individual's own personality, etc. And recent literature indicates that the success of a dental graduate working in a clinic or in any education institute relies only 20 to 30% on his academic or clinical skills and 80% on the non-cognitive skills, or as we say, the soft skills. And the term non-cognitive, it refers to the personal attributes of an individual, the attitude, the behavior, and the socio-emotional factors that contribute to an individual's success. Some of these skills may be learned over time by observation and reflection, and some might be inherent to an individual's personality. Either way, each professional role requires a specific set of hard and soft skills to succeed. And mostly informally, but there are several dental schools that claim to incorporate these skills like communication skills, leadership skills, empathy, professionalism, and many schools have identified different skills. And and research shows that there are several methods of assessment of these skills as well. There are several methods include like PMX, the professional environment and role modeling evaluation, and the multi-source feedback, etc. Although these methods are quite diverse, they possess uncertain psychometric properties, and they have indeterminate ratings of content and criterion validity. So the situational judgment test is an assessment method designed specifically to measure an individual's judgment in complex and contextualized workplace settings in the form of scenario-based questions. And these SJTs have been used to determine an individual's non-academic attributes like empathy, integrity, teamwork, critical skills, etc. And these soft skills are measured by assessing an individual's response to a number of hypothetical role-relevant scenarios, which reflect the situation the candidates are likely to encounter in a target role. So although the final year dental students begin to deal with patients, they are almost always supervised by their seniors or professors or teachers. They complete all dental procedures from simple fillings to scalings, root canals, and even extractions, but each clinical case is completed under supervision. And most of the times they do not have to deal with difficult patients or non-compliant family members, and they're not exposed to manage the patient fees or even to negotiate with the patients. And the entire focus of the teachers is to equip their students with the clinical skills. And in all these cases, we see that they rarely treat a patient independently during their undergraduate years, and yet they are expected to work efficiently just right after they graduate. So to overcome this problem, it is imperative that the students and educators be aware of the essential non-cognitive attributes, and these attributes may differ from other professionals, specifically due to the nature of our clinical work. And in this study, we aim to provide the domains of soft skills that must be included in the dental students. So the situation judgment approach has been used to assess personnel selection for over half a century. Notably, we have seen it in World War II to evaluate soldiers. And in the last 2 decades, they have become very popular. They're being used worldwide for recruitment of teachers, police reinforcements, IT tech, etc. And recently, they have been used for the admission of undergraduate medical and dental students. And what do these SGTs assess? They assess the non-cognitive attributes like integrity, emotional intelligence, information-seeking skills, and all the soft skills that are required to work in a work-based setting. So what is our research question? This study will explores the essential non-cognitive attributes, which can help the educators plan to inculcate those attributes in dental student. The study will determine the use of situation judgment test in assessing the attributes, we have a research question and we have sub-research questions as well. What are the non-cognitive attributes considered necessary for a fresh dental graduate? So to answer this research question, first we need to identify the essential attributes that are necessary for a dentist and what SGT can be used. So then we have, what we did was that we designed the situational judgment test just for the final year dental students. And then to answer the research question 3, we actually piloted that the situation judgment test on the final year dental students. And once they completed their test, we also acquired the perceptions of the applicants for the content and use of SGT for assessment. So a mixed method study of exploratory sequential design was chosen for this study. And the exploratory sequential is a 2-step approach, starting with a qualitative analysis used to explore a phenomena, and then it builds onto a second questionnaire phase. So the design was suitable for our study because SGT items were constructed based on the non-cognitive attributes explored, and the SGT items were later piloted on the final year dental students collective. So these were the 4 stages in which we conducted our study. Now, the phase 1 was used to build specifications for SGT items by identifying the non-cognitive attributes of dentists. Due to scarce research in the subject, an exploratory approach was taken, and a discussion guide was created when we conducted a focus group discussion with subject matter experts. For the subject matter experts, a homogeneous purposes sampling was done to recruit these experts. These were people considered the people who have worked for more than 5 years in the field of dentistry, both basic and clinical sciences. And we interviewed them for about 90 to 100 minutes. And once the interview was done, a thematic analysis of the data was done, in which we had a descriptive analysis followed by generation of initial codes, and then the final interpretive analysis. Now for the phase 2, we had to construct the SGT items for dental student. Till now, there is no consensus in literature about the formation and scoring of the SGT. So the role analysis that was done in phase 1 was using the inductive approach, resulted in broad domains of non-cognitive attributes. And based on those domains, critical incident reports were formed, and we constructed the SGT items for each domain. And after constructing the item, we also built the answer key and the score. So after the SGT test was conducted, we need to establish the face and content validity of the test by reviewing it with a small group of experts. And review by expert was necessary to ensure that the test is fair, realistic, and relevant to the role. So once the SGT test was validated, in the last phase, it was piloted on final year dental students who were at the end of their academic year, and the aim was to measure the respondents' test results, their attributes, and to obtain the participant feedback on the relevant test. And the online test consisted of a brief introduction about what it was about, and it also it had the demographic information, and it consisted of 70 test items and 10 questions for a feedback form. So the analysis was done by calculation of mean and standard deviation of the responses. Distribution of SGT was analyzed using descriptive statistics, mean, standard deviation, frequency, percentage, and histogram. The score of the participant in each domain was tested by calculating the average in percentage, and t-test was applied used to compare the means between male and female participants. P-value less than 0.05 was considered significant. As for the test itself, Cornbeck alpha was used to determine the internal reliability of the test. So after the first phase, after the focus group discussion and the thematic analysis from the experts, we concluded that there were a total of 131 attributes were identified. And after merging them and merging the familiar codes and removing redundant codes, we got 41 attributes, and a total of 3 themes were identified. 3 themes, namely conventional skills, tribal skills, and occupational skills. So if we define them, conventional skills would be the latent skills of an individual that are learned or adapted during development. These skills are learned from parents, teachers, or peers. With these include the intrapersonal skills or the approach to learning. Then we identified a theme of tribal skills. These are the set of skills required for a person to survive in a community. In case of dentists in a hospital or a dental clinic, most of these are learned from the environment by interacting with people. And the theme included the sub-theme of interpersonal skill and diverse experiences. And lastly, we identified occupational skills. These are the skills specific to a certain job. And in terms of dentistry, these are skills required to perform well in a dental institute or a hospital. And these skills included management skills, professional ethics, and aesthetics. So once we identified 3 themes and 7 sub-themes, we developed the SJT items on these 7 sub-themes. So these 7 sub-themes or domains were used, and we assessed these for the students as well. So if we look at the literature, the UK Foundation exam, it already consists of the 50% SJTs, and it assesses the professionalism, communication skills, and patient-centered care of the students. They are the students that are going to be inducted in the dental school. And similarly, Virtue et al. In 2017 explored the non-cognitive attributes, and there were a lot of attributes that are also identified in our study, like empathy, communication skills, professionalism, etc. And in Canada, of course, we see the Association of Canadian Faculties of Dentistry. They also include the non-cognitive skills in their curriculum, and University of Florida also does that. So what is different in our study is that we have provided a list of non-cognitive attributes, a very concise list which has not been provided previously. And also it is a very good contextual study. In our context, it has never been done before. And another very important factor is that all of the previously conducted studies, they only used SJT item for induction of students in a dental school. Whereas we, in our study, we were the first one to develop an SJT item for dental students studying in dental school and who are getting ready to prepare for their professional life. Now, in the phase 2, what we did was that this is an example of the SJT item. As you can see that we have a scenario, and the scenario has 5 options, and we asked the student to rank response them. Which means is that they have to rank the most appropriate answer first and the least appropriate answer in the last. So this was the item after we identified the subdomains, 7 subdomains, we created 10 items per domain. So we created 70 item SJT. And then these were constructed from critical incident reports, and each item was numbered as 1A, 2A, and further so on. After construction, the rank response item scoring was done through concordance panel, and responses with more than 80% consensus were accepted, and items with 50 to 79% consensus by experts were revised. So you can see that in item number 2A, the response number D was revised. And the response options with less than 50% of consensus from the expert was discarded and rewritten. So during the validation process, the option number in the SJT item number 5B, the option C was discarded because it did not contain obtain consensus from more than 50% of the experts, and so we had to revise it. Similarly, this is the overall picture showing the number of items that we revised to get the internal consistency best of the test. And after which the final test was of the 70 items was piloted on 150 dental students. And the mean age of the students was 23, and it had 44% male students and 56%
Excuse me, Dr. Ayesha.
female students. Yes,
I just wanted to remind you that you have 5 minutes remaining for your presentation.
Yes, of course. I'm going to just end it now. So we also checked the Cronbach alpha value of each domain, and as you can see, we had good internal validity of the items. Also, this means that the SGT was well constructed. And the scores of the student, you can see clearly that students scored very well in a few domains. Like management skills, the student scores highest in management skills, and they scored lowest in the professional ethics. And we also collected their perception, and 66% of the respondents felt that the test was too easy, and about 73% of the respondents scored that it is a very valid and clear test. So a lot of previous studies have been conducted on SGTs, but especially in pharmacy and nursing. And this is the first study that has been conducted to score non-cognitive skills of dental students. So in conclusion, these attributes are essential for a person's success in job, and 3 main skill themes and 7 themes were identified. And the result of 70 item SGT and the perception of the students suggest that the situational judgment test can be an effective tool to assess the non-cognitive attributes of dental student. Our study has provided a comprehensive list of attributes essential for fresh dental graduates. We have developed a valid and reliable tool for finally dental students, and we have also measured the attributes of dental students. And what we recommend is that it can be useful for educators and policymakers and institutional heads. And with sufficient training, faculty can be trained to incorporate the attributes into their students. And students can be assessed an objective assessment and marked based on their performance. Score on each domain can be added to their transcripts, differentiating them from other job candidates. We had a few limitations due to the time restraint of the study, but overall it was a good study with excellent results, and it can be used further as well. So thank you so much for your patience.